One treatment in particular has been getting a lot of attention.
Hydroxychloroquine.
Hydroxychloroquine
could be used as a possible treatment for coronavirus.
Suggesting a benefit to hydroxychloroquine.
There's no evidence that people should go out and start taking this.
I'm taking it, hydroxychloroquine. Right now, yeah.
The COVID-19 infodemic is an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance. This can lead to adverse public reactions such as fear, inappropriate prescribing, less response to warnings on issues such as social distancing, mistrust in medical advice, and potential shortages in certain drugs. In the context of COVID-19, communication regarding hydroxychloroquine as a potential treatment has often been overwhelming and contradictory. Other drugs such as azithromycin, remdesivir, and dexamethasone have also been discussed as possible COVID-19 treatments. The COVID-19 infodemic is further exacerbated by social media such as Twitter. Twitter acts as a space for the informal sharing of health information with the ability to mass circulate information. The nature of Twitter's platform can be an especially dangerous breeding ground for misinformation and rumors. This paper aims to investigate the extent to which public behavior and attitude are influenced by public sources communicating conflicting information on hydroxychloroquine as a COVID-19 treatment. Public behavior was measured by analyzing the number of hydroxychloroquine-related tweets and changes in physicians' prescription rates of hydroxychloroquine. Public attitude was measured by analyzing the changes in sentiment of hydroxychloroquine-related tweets. As a secondary aim, we extended these measurements to other potential COVID-19 therapeutics. For this study, we have categorized most public sources into three categories: the U.S. federal government, publicly recognized organizations, and research publications. To begin our research, significant events related to hydroxychloroquine as a COVID-19 treatment were first identified and categorized in relation to three types of public sources. Based on those dates, data regarding hydroxychloroquine and related drugs were collected from two sources. These drugs were chosen in addition to hydroxychloroquine after conducting a literature review of potential COVID-19 drug treatments. First, data showing the percentage of physicians in the U.S. who prescribe hydroxychloroquine, azithromycin, or remdesivir to treat COVID-19 was derived from the weekly online survey. Secondly, tweets with the keywords hydroxychloroquine, remdesivir, azithromycin, or dexamethasone were scraped from Twitter using an open-source program. The tweets were then analyzed for sentiment using Behaviour, a valence-aware dictionary and sentiment reasoner. Behaviour was chosen based on its accessibility, accuracy, and the fact that it was designed to classify social media text. A combination of the three outputs of our data extraction was then analyzed to draw observations and conclusions using R.
In addressing our first aim of investigating the influence of public sources on public behavior, we looked at the number of hydroxychloroquine-related tweets. When looking at events that occurred before peaks in the number of tweets, it appears that the majority of the events originated from the U.S. federal government. President Trump, on behalf of the government, supported hydroxychloroquine during the first notable increase in the number of tweets. Following endorsements from Trump on May 18th led to the largest increase in hydroxychloroquine-related tweets throughout the entire pandemic. When examining public sources' influence on physician behavior, we found an increase in the percentage of physicians who prescribe hydroxychloroquine, which suggests that physician behavior could also be affected by public sources. However, it does seem like physicians are less susceptible to recommendations about the drug and tend to be more cautious in the prescription of this controversial therapeutic. Despite continued endorsement of hydroxychloroquine from President Trump during this time period, the percentage of physicians using hydroxychloroquine steadily decreased to return to pre-infodemic rates. To confirm the possible differential impact of each public source, an aggregate analysis of the events based on public sources was performed. The U.S. federal government yielded the greatest average number of tweets and had a statistically significant difference compared to organizations and research publications. This suggests that the federal government holds a disproportionate amount of influence on public behavior in terms of the number of hydroxychloroquine-related tweets.
To investigate the change in public attitude associated with the different public sources, we looked at the change in the percentage of positive and negative tweets over time. Overall sentiment became increasingly negative, with the alignment of peaks and drops in the percentage of positive and negative sentiment to significant events. This suggests that people's attitudes towards hydroxychloroquine is flexible to change and that public sources can affect attitude. Similar to our analysis of behavior, the impact of each public source on sentiment was investigated through an aggregate analysis. The federal government once again generated the largest relative percentage change in sentiment for hydroxychloroquine, with a statistically significant difference compared to all the other groups. Meanwhile, organizations and publications were found to be statistically insignificant compared to the control. This hints that the US federal government's influence extends to public attitudes as well, while organizations and publications show little to no influence for neither behavior nor attitude. To address the secondary research aim, we examined the correlation in public behavior and attitude between hydroxychloroquine and other COVID-19 related therapeutics to determine the potentially far-reaching effects of public sources when disseminating hydroxychloroquine related information. The number of tweets associated with similar drugs and the percentage of physicians prescribing hydroxychloroquine were evaluated to elucidate public behavior. Most of the peaks in the number of azithromycin, remdesivir, or dexamethasone related tweets do not coincide with peaks in the number of hydroxychloroquine-related tweets. Only azithromycin showed a statistically significant positive linear correlation in the number of tweets compared to hydroxychloroquine. Similarly, azithromycin exhibited a positive correlation in prescription rates with respect to hydroxychloroquine prescription rates, as supported by the concordant patterns of increases and decreases. The positive linear correlations present between azithromycin and hydroxychloroquine may be attributed to the tendency for these two drugs to be used in combination for COVID-19 related studies and treatments. When examining the far-reaching effects on the attitude towards other drugs, we performed a regression analysis between sentiment towards hydroxychloroquine and the other treatments. Azithromycin and remdesivir exhibited a positive correlation with hydroxychloroquine as shown by the statistically significant p-values. Meanwhile, dexamethasone showed a lack of correlation to hydroxychloroquine for parameters related to both behavior and attitude. Overall, these results suggest that information disclosed about hydroxychloroquine can have far-reaching influence on public sentiment and behavior towards tangentially related drugs.
From the study, it was found that Trump had a statistically significant influence on public behavior and attitude, unlike organizations and publications. Public sentiment on hydroxychloroquine had also been observed to become more negative over time, suggesting that public attitudes towards controversial topics can change. Finally, the positive correlation observed between hydroxychloroquine and other drugs indicates that events related to hydroxychloroquine can also affect public sentiment and attitude of other related treatments. Based on these conclusions, 3 themes of solutions can be offered. The first theme is based on using education to empower individuals of all ages to develop critical thinking and digital literacy skills. Online courses or incorporation of a digital literacy component into school curricula could foster the ability to make critical judgments about the legitimacy of news sources and evaluate their biases. The second theme is focused on the improvement of social media platforms in labeling misinformation, to upgrade the public's ability to make judgments. This would be achieved by placing links next to or flagging popular posts for possible misinformation on major social media platforms. Finally, the last theme involves the cooperation between entities with strong influence, for example, the federal government, and reputable sources for public health measures. Partnerships between health organizations with prominent celebrities, for example Trump, would boost the organization's reach and influence. These 3 themes, when implemented together, can provide long-term solutions and address any current misinformation to mitigate shortcomings that a single approach alone would present. To extend our research in the future, more accurate results could be obtained by using a custom-trained model for sentiment analysis. It would also be valuable to conduct a similar version of the study on other social media platforms to compare and contrast the influence of public sources and their statements. We hope that this research will help us better understand one of the biggest challenges that we face in the information age.